Today we're going to show you guys how to do sterile suction on a mannequin. You're going to need all of the necessary equipment to start, which is the sterile suction kit, the NPA, lubricant, and sterile water, the vacuum gauge, which is already connected, and the container. If the patient is already on O2, you're going to want to hyperoxygenate, so you're just going to up the flow meter. In this case, the patient is not. So before we start, we're going to take their vital signs. So we're going to do breath sounds, S formation, obviously, like how he's doing. And then we're going to start with turning on the gauge, making sure it's working properly. When you're doing this, you're going to let the patient know what you're doing. And then you're going to take the NPA and measure it from the tip of the ear to the middle of the nair. So next he's going to start with opening the kit, pulling out the gloves, making sure he is still sterile. And then when he's doing this, he's going to use his dominant hand. So the dominant hand is going to stay sterile. Okay, perfect. So he's going to take out the catheter, making sure that that stays sterile, and then he's going to connect it. Okay, so you can hear a little hissing, which means it's on. And then, so before he puts it in, over here, the white part is where the suctioning is actually controlled. So when you are not pressing it, that means that he's not suctioning. And then when you do press it, that's suctioning. Okay, so when you enter into the patient's nose, you're not going to be suctioning. You're going to go in until you feel some resistance, then you will stop. Okay, so now he's going to start suctioning and slowly pulling out while keeping the catheter in his hand so it doesn't go everywhere. And then once he gets to the very tip, he's going to go ahead and just wiggle it around. Then he's going to go ahead and put that back into the sterile water to make sure that all the gunk comes out. Okay, so he's going down until he feels some resistance without suctioning. Once he feels some resistance, he's going to go ahead and start suctioning for 10 to 15 seconds. And at the end, he's going to wiggle around to get all that out. So now that the suction is done, he's going to go ahead and just clean up. So now that hand doesn't need to be sterile anymore since he is done. He's just going to go ahead and wrap the catheter into that glove and just toss everything out. So before leaving, we're going to check the patient's vitals again. So S formation again, making sure everything's okay. And then we're going to want to chart that into the patient's chart.
Now let's go over the indications and the contraindications of nasotracheal suctioning. Indications. Airway suctioning is indicated for multiple reasons. Most commonly, suctioning is done for the removal of secretions from the respiratory tract, but sometimes also for the removal of blood or other materials like meconium in specific cases. Airway suctioning is also performed for diagnostic purposes. For example, airway secretions may be sent for microbiological and histological review. Additionally, suctioning is performed to maintain the patency of artificial airways such as an endotracheal tube or a tracheostomy tube. Contraindications for nasotracheal suctioning. Nasal trauma or bleeding. Suctioning can cause nasal bleeding and trauma, especially for patients with thin blood. Nasal fractures or surgery. Recent nasal surgery or fractures can make nasotracheal suctioning dangerous. Bleeding disorders. Coagulopathy or bleeding disorders can increase the risk of bleeding. Occluded nasal passages. Blocked nasal passages can make nasotracheal suctioning difficult or impossible. And that concludes our sterile suctioning project. Thank you guys for watching. Bye!